Never put your baby to sleep on a soft surface. Never dress your baby too warmly for sleep, and keep the room cool. Never allow anyone to smoke near your baby or take him or her into somewhere where someone has recently smoked. Hi everyone, I'm Lian from Sleepy Baba. It has come to my attention that many parents are anxious about their baby's safety while sleeping. So let's take a look at what you can do to ensure that your baby sleeps as safely as possible. First and foremost, congratulations on the arrival of your little bundle of joy. Now that your baby is here, what can you expect? Take out your notebook and a pen because you might want to jot this down. Life for your baby is pretty simple right now. All that really matters to your little one is eating every couple of hours, sleeping safely and frequently, having a clean diaper, and receiving lots of love. That's it. However, life as a new parent with all that entails may feel more complicated than that. So, my advice is to just focus on the essentials, your baby's basic needs. This is the time to put laundry, cooking, and other household chores in the backseat as much as possible. Ask your friends or family for help. If possible, order your meals in or simply ask a friend or family to bring you some food. If you need help with feeding your baby, consult a healthcare provider or a lactation consultant. Let's address the elephant in the room. Sudden infant death syndrome, or SIDS for short, is the unexpected and unexplained death of a seemingly healthy infant during sleep with no medical explanation. It is the most common cause of infant death between the ages of 1 week and 1 year old. So, parents, don't take this lightly. Over the years, many risk factors have been identified, and thankfully, there are things you can do to significantly reduce the likelihood of SIDS. Just to name a few. Number 1 is to have a healthy pregnancy. Premature birth and low birth weight are two risk factors, and while they are not always preventable, eating a healthy diet and receiving good prenatal care can help. Number 2, don't allow anyone to smoke near your baby. This is because exposure to cigarette smoke both before and after birth is one of the most significant risk factors. Studies have shown that when babies breathe in cigarette smoke, their risk of SIDS doubles. Number 3, put your baby to sleep on his or her back. This is extremely important. Research shows that doing so reduces the risk of SIDS by nearly 50%. Number 4, if possible, breastfeed your baby. Although researchers can't pinpoint the specifics, SIDS rates tend to be lower in breastfed babies. Number 5, provide a safe sleeping environment. Avoid putting your baby to sleep on soft surfaces that he or she can sink into, such as beanbags, soft beddings, or even couches. There are a few simple rules that parents should follow. The first rule is to always put your baby to sleep on his or her back during naps and at night. Second, always use a crib that not only meets the current safety standards, but also has a firm mattress that fits snugly and is covered only by a crib sheet. Remove all soft bedding and toys from your baby's sleeping area. This includes cot mobile, loose blankets, cot bumpers, pillows, and baby positioners. You should also use a wearable blanket like a sleep sack or a sleeping bag rather than a loose blanket to keep the baby warm. Breastfeed if possible, but when you finish feeding, place your baby in his or her own separate sleeping area, preferably next to your bed. As for the no-nos, never put your baby to sleep on a soft surface. Never dress your baby too warmly for sleep, and keep the room cool. Never allow anyone to smoke near your baby or take him or her into somewhere where someone has recently smoked. I'm also frequently asked whether co-sleeping increases the risk of SIDS. Well, there has been a lot of controversy about whether babies who sleep in bed with their parents are at a greater risk of SIDS. Personally, I believe that a baby is safest in his or her own crib or bassinet. I also believe that this is the best way to encourage great independent sleep skills and establish healthy sleeping habits in your baby right from the beginning. That being said, if you do intend to co-sleep, please make sure to do so properly. Avoid piling up blankets and soft pillows around your baby. And never sleep with your baby if you have been using drugs or alcohol. Practice these rules and preventive steps. And remember that while SIDS is real, it is rare. Try to relax and enjoy parenthood. However, if at any time you find you and your little one struggling with sleep and need some expert advice, I'm always happy to help. Just schedule a free 15-minute discovery call with me to learn how I can help you and your little one sleep safe and sound.